Hi, I'm Blenda Varela, a registered nurse taking this course called Philosophical Foundations of Nursing at Athabasca University for the Master of Nursing program. My presentation is on the analysis of classic and contemporary nursing theorists. I'll be highlighting the classic nursing theorist Virginia Henderson and the contemporary nursing theorist Catherine Kolcaba. Virginia Henderson was an American nursing theorist and educator born November 30th, 1897. She earned her nursing diploma from the Army School of Nursing in Washington, D.C. in 1921. After 2 years working as a visiting nurse, she started teaching. She obtained her bachelor's degree in 1932 and master's degree in 1934. She became a Columbia University faculty member until 1948 and then became a research associate at Yale University School of Nursing. She received numerous recognitions and honorary doctoral degrees from various universities. Henderson died March 19, 1996. Catherine Kolcaba is an American theorist and professor born on December 28, 1944. She obtained her nursing diploma from the School of Nursing at St. Luke's Hospital in 1965. She earned her MSN and PhD from Case Western University in 1987 and 1997, respectively. She had experience working in medical and surgical units, operation theaters, home health, and long-term care. Henderson is accredited with the need theory developed in the 1950s. It emphasizes the importance of increasing the patient's independence so that progress after hospitalization can occur promptly. She defines the unique function of the nurse is to, in quotes, assist the individual, sick or well, in the performance of activities contributing to health or its recovery or to peaceful death that they would otherwise perform unaided, and to do this in such a way to help them gain independence as rapidly as possible, end quote. That's by Henderson, 1966, as cited in Atisham and Jacqueline, 2015. Henderson categorized nursing care interventions into 14 components centering on basic human needs. Components 1 to 9 are physiological. Components 10 and 14 encompass psychological aspects. Component 11 is spiritual and moral. Components 12 and 13 are sociological. Kolcaba is accredited for the comfort theory developed in the 1990s. She asserts that comfort is a holistic experience resulting from needs satisfaction in the 3 types of comfort. Relief, which is attained when the most basic needs are met. Ease allows the person to feel calm and contentment. Transcendence is a state where the needs that allow someone to make plans, solve problems, or sense of control over their destiny are satisfied. The human experience of comfort occurs in 4 domains. Physical comfort pertains to the physiological and homeostatic dimensions. Psychospiritual is the internal awareness of self and relationship with a higher power. Sociocultural comfort encompasses the interpersonal, family, and societal relationships. Environmental context pertains to the external surroundings, conditions, and influences on human experiences. The comfort concepts can be plotted against any of the 4 domains in the taxonomic structure as depicted in Table 2. Some assumptions of the need theory include that nurses care for patients until they can care for themselves once again, and that patients desire to return to health, and that nurses are willing to serve and devote themselves to the patient day and night. Some assumptions of the comfort theory include human beings having a holistic response to a complex stimuli, and comfort is a desired holistic outcome, and that human beings strive to meet or to have met their basic comfort needs. Please pause and read this practice scenario involving Mrs. X. Using the need theory, the nurse focuses on increasing Mrs. X's participation in completing ADLs, promoting sleep hygiene, participation and compliance with treatment, therapeutic communication, and providing support to the client and her family as needed to provide holistic care. The overall aim is for Mrs. X to regain stability physically and mentally, to get back to independent self-care and functional abilities as quickly as possible. With the comfort theory, the nurse holistically addresses and satisfies the comfort needs of the patient as a result of growth in understanding of Mrs. X and fostering the nurse-client relationship. It goes beyond symptom management or overcoming the illness. It facilitates a supportive and healing environment. The strengths of both theories are its simplicity to apply to nursing practice and its applicability to all clients requiring care. The limitation of the need theory is the lack of explanation given on what a nurse can do to provide peaceful death, and that there is no conceptual diagram that interconnects the 14 concepts. Whereas the comfort theory limitation is that comfort is almost always associated with physical factors. Although comfort is a recognized measure of quality care and is a fundamental need that everyone understands and desires to have met, it still is complex and difficult to define, implement, and evaluate. Here are my references, and thank you for listening to my presentation.